Adnexitis is a medical term for the inflammation of the adnexa, which are the structures connected to the uterus, specifically the fallopian tubes and the ovaries. While you might hear the term adnexitis, it is more commonly and broadly referred to as pelvic inflammatory disease, or PID. PID is an infection and inflammation of the female upper reproductive tract, including the uterus, fallopian tubes, and ovaries. It is a serious condition that can have significant long-term consequences if not treated promptly and effectively. Understanding what PID is, recognizing its symptoms, and knowing the importance of seeking immediate medical care are crucial for protecting your reproductive health and future fertility. This condition is not something to be ashamed of. It is a medical illness that requires proper care. Types and classifications of adnexitis or PID. PID is generally classified based on its onset and severity, which helps guide treatment. Acute PID. This form of the disease has a sudden and often severe onset of symptoms. The infection is active and the inflammation is strong. This is the stage where prompt treatment with antibiotics is most critical to prevent long-term damage. Chronic PID. This refers to a long-term condition that usually results from a past episode of acute PID, especially if the treatment was delayed or incomplete. It is not typically an active infection, but rather the aftermath of the initial infection. Chronic PID is characterized by persistent pelvic pain, and it is associated with the scarring and adhesions that formed as a result of the initial inflammation. The condition can also be described as silent or subclinical. Subclinical PID is a low-grade inflammation that may produce very mild symptoms or no symptoms at all. This form is particularly dangerous because the damage to the reproductive organs can occur without a woman ever knowing she has an infection. The causes of adnexitis and PID. PID is almost always caused by an ascending infection. This means that bacteria from the vagina or cervix travel upwards into the normally sterile environment of the upper reproductive tract, which includes the uterus, fallopian tubes, and ovaries. The cervix usually acts as a barrier to prevent this from happening, but this barrier can be compromised. The most common causes are sexually transmitted infections, or STIs, chlamydia and gonorrhea. These two bacterial STIs are responsible for a large percentage of PID cases. They often cause an initial infection in the cervix, a condition called cervicitis. If this initial infection is not treated, the bacteria can ascend into the uterus, causing endometritis, and then travel into the fallopian tubes, causing salpingitis, and to the ovaries, causing oophorytis. Adnexitis specifically refers to the inflammation of the tubes and ovaries. Other bacteria. Sometimes PID can be caused by an imbalance of the normal bacteria found in the vagina, similar to the bacteria that cause bacterial vaginosis. Certain events can increase the risk of bacteria ascending into the upper reproductive tract. These include menstruation, as the cervical mucus barrier changes, and recent gynecological procedures, such as the insertion of an intrauterine device or IUD, though this risk is primarily confined to the first few weeks after insertion. Douching is also a significant risk factor as it can push bacteria up into the uterus and disrupt the natural protective balance of the vaginal flora. The clinical journey of this condition. The clinical course of PID can have profound and lasting effects if not managed properly. During an acute infection, the inflammation in the fallopian tubes can cause the delicate inner lining to become scarred. The body's immune response rushes to fight the infection, but this process itself can contribute to tissue damage. The fallopian tubes can become partially or completely blocked by this scar tissue. The inflammation can also cause adhesions, which are bands of scar tissue that can form between organs, essentially gluing them together and distorting the normal pelvic anatomy. If the infection is severe, it can lead to the formation of a tubo-ovarian abscess, which is a pocket of pus that forms in the fallopian tube and ovary. This is a very serious complication that often requires hospitalization and sometimes surgery. The long-term consequences of PID are primarily related to the scarring and damage left behind after the infection has been treated. These include chronic pelvic pain. This is a persistent aching pain in the lower abdomen that can last for months or years and significantly impact a woman's quality of life. Infertility. PID is a leading cause of preventable infertility. If the fallopian tubes are blocked by scar tissue, it can prevent the egg from traveling from the ovary to the uterus and can block sperm from reaching the egg. The risk of infertility increases with each subsequent episode of PID. Ectopic pregnancy. If a fallopian tube is only partially blocked or damaged by scarring, a fertilized egg may get stuck in the tube instead of traveling to the uterus. This is called an ectopic pregnancy, which is a life-threatening medical emergency. The risk of having an ectopic pregnancy is much higher for women who have had PID. Recognizing the symptoms of PID. The symptoms of PID can range from severe to very mild, and in some cases there may be no symptoms at all. This is what makes the disease so dangerous. When symptoms do occur, they can include pain in the lower abdomen or pelvis. This is the most common symptom. It can be a dull ache or more severe cramping, fever, a body temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, sometimes with chills, abnormal vaginal discharge. The discharge may be heavy and have an unusual color, such as yellow or green, and may have an unpleasant odor, pain or bleeding during intercourse. This is also known as dyspareunia, bleeding between periods, any irregular spotting or bleeding, a burning sensation during urination. This can sometimes be mistaken for a urinary tract infection. Because these symptoms can be subtle, they are often ignored or mistaken for other conditions. It is essential to seek medical care if you experience any of these signs, especially if you have a new sexual partner or have had unprotected sex. Getting professional help, diagnosis and evaluation. If you have symptoms that suggest PID, it is crucial to see a healthcare provider right away. You can go to your gynecologist, a family doctor, or an urgent care clinic. There is no single simple test for PID. The diagnosis is often made based on a combination of your symptoms and the findings from a physical exam. 1. Medical history. Your doctor will ask about your symptoms, your sexual and contraceptive history, and whether you have had any STIs in the past. 2. Pelvic exam. A pelvic exam is essential. Your doctor will be checking for specific signs of PID. The main finding is usually tenderness when the cervix is moved, or when the doctor palpates the area of the uterus and adnexa. This is called cervical motion tenderness and adnexal tenderness. 3. Laboratory tests. Testing for STIs. Your doctor will take swabs from your cervix and vagina to test for chlamydia and gonorrhea, the most common causes of PID. Blood tests. Blood tests may be done to check your white blood cell count and other markers of inflammation. 4. Imaging. Pelvic ultrasound. An ultrasound can be used to get a better look at the reproductive organs. It can help rule out other conditions and can sometimes identify thickened fallopian tubes or a tubo-ovarian abscess. In some cases, if the diagnosis is unclear or the infection is severe, more invasive procedures like a laparoscopy might be used. This allows a surgeon to look directly at the pelvic organs to confirm the presence of inflammation and scarring. However, this is not typically needed to start treatment. Treatment and management of PID. The primary treatment for PID is a course of antibiotics. Because PID is often caused by a mix of different bacteria, treatment usually involves a combination of at least 2 different broad-spectrum antibiotics. Prompt treatment is key to preventing long-term complications. Your doctor will likely start you on antibiotics even before all the test results are back, based on a clinical diagnosis. The antibiotics are usually taken orally for about 14 days. It is absolutely essential to complete the entire course of medication, even if you start to feel better. Stopping treatment early can lead to the infection not being fully cleared, which increases the risk of long-term damage. In severe cases, or if you are pregnant or cannot take oral medication, you may need to be hospitalized to receive intravenous or IV antibiotics. Your sexual partner or partners from the last 60 days must also be treated for STIs, even if they have no symptoms. This is to prevent you from being reinfected and to stop the spread of the infection. You should not have sex until you and your partner have both completed treatment. Rehabilitation and living with the aftermath. Rehabilitation after an episode of PID focuses on ensuring the infection is cured and managing any long-term consequences. A follow-up visit with your doctor after you finish your antibiotics is important to make sure the treatment was effective. For women who develop chronic pelvic pain, management can be complex and may require a multidisciplinary approach involving pain management specialists and pelvic floor physical therapists. Coping with an infertility diagnosis resulting from PID can be emotionally devastating. It is important to seek support from your healthcare provider, a counselor, or support groups. A reproductive endocrinologist can discuss options like in vitro fertilization or IVF, which can often bypass the fallopian tube damage. The most important aspect of rehabilitation is preventing another episode of PID, prevention and protecting your future health. Preventing PID is all about preventing the infections that cause it. Practice safe sex. Using condoms consistently and correctly every time you have sex is the most effective way to prevent STIs like chlamydia and gonorrhea. Get regular STI screening. If you are sexually active, especially if you are under 25 or have new or multiple partners, you should be screened regularly for STIs. Since these infections are often asymptomatic, testing is the only way to know if you have one. Ensure your partners are treated. If you are diagnosed with an STI, make sure your partner gets treated to avoid getting reinfected. Avoid douching. Douching can upset the balance of bacteria in your vagina and can push harmful bacteria up into the uterus. Research and expert perspectives. Research in the field of PID is ongoing. Scientists are working on developing better and faster diagnostic tests to allow for earlier treatment. There is also significant research into the long-term inflammatory and immunological consequences of the disease. Leading medical organizations like the U.S. Centers for Disease Control and Prevention, or CDC, provide detailed and regularly updated treatment guidelines for PID. These guidelines are the standard of care for doctors across the country. The CDC emphasizes the importance of treating PID empirically, meaning treatment should be started based on clinical suspicion, without waiting for definitive test results, because of the serious potential for complications. The American College of Obstetricians and Gynecologists, or ACOG, works to educate both doctors and patients about the dangers of PID. They stress that PID is a serious infection that can affect your future fertility. It is important to recognize the symptoms and seek care right away. Experts in the field often speak about the tragedy of the silent epidemic. Dr. H. Hunter Hansfield, a renowned expert in sexually transmitted diseases, has written extensively about the public health impact of untreated STIs. A theme in his work is that the severe consequences of PID, like infertility, are almost entirely preventable with better screening and early treatment of the underlying infections. The collective message is one of urgency and prevention. PID is a serious condition, but it is preventable. By taking control of your sexual health, practicing safe sex, and getting regular checkups, you can protect yourself from this damaging infection.